Hello, and welcome back. I really hope you enjoyed the briefings on the 2021 NBNA toolkit, and I hope you enjoyed the musical interlude that really highlights the NBNA reset program, so graciously funded by the Pfizer Foundation. Um, we're now going to move into a presentation um, from Pfizer. And I want to introduce Dr. Dara Richardson-Heron, who is a physician by trade and an advocate by choice. As Pfizer's chief patient officer, Dr. Richardson-Heron leads the company's work to advance patient-focused programs and platforms with the goal of better responding to patients and community needs and reducing health disparities. Dr. Richardson-Heron's 25-year career has spanned academic, government, for-profit, and not-for-profit sectors, and she has held executive leadership positions at organizations including the National Institute of Health, the YWCA USA, and the Greater New York City affiliate of Susan G. Komen for the Cure. Dr. Richardson-Heron is going to provide a presentation entitled COVID-19 Vaccine Efficacy, Trust, Awareness, and Empowerment. Dr. Heron Richardson.
Thank you so much, Dr. Fields, for that kind introduction. And let me also extend my heartfelt congratulations to you, to Dr. Dawson, and of course, your amazing executive director, Dr. Millicent Gorham, and truly the entire NBNA membership on your 33rd annual day on Capitol Hill. It's an honor for me to be here with all of you today. And, as Dr. Fields mentioned, I am a physician by trade and an advocate by choice. At age 17, I actually came from my place of birth to New York. And my place of birth is Oklahoma City. And certainly we can all agree that Oklahoma City and New York are two very different cities. But I came to New York to study biology at Barnard College and to study medicine at New York University. And I completed my internal medicine residency in New York at Bellevue Hospital, which many of you know is the oldest public hospital in the United States. And looking back at my career, my training at Bellevue was in many ways an inflection point because it was there where, after years of studying medicine in academic settings, I actually saw real patients, many from underserved communities who, through no fault of their own, presented with late stage disease, often because they had limited or no access to healthcare. And it was also at Bellevue where I was taught how to provide effective, culturally sensitive, high quality, and life saving healthcare to diverse patients from all walks of life. And let me be clear, much of what I learned about how to truly take care of patients, it came from watching some of the most amazing nurses in the world. And this is not my first time saying this. It's not lost on me that I'm talking to the NBNA, but I have said this many times. I loved your opening video. Not just the reset one, but the very beginning one that I got a chance to see. But I have one respectful suggestion for the 34th annual Day on Capitol Hill. I hope you'll not only applaud your longstanding efforts to train other nurses, but I want to remind you, and I think you should remind the world that you train many doctors as well. And I'm confident that I speak for many other physicians who will be forever indebted to the incomparable nurses who taught us how to really take good care of patients. So let me thank you all collectively. And I also want to mention that I trained as a physician at the height of the AIDS epidemic, when we had extremely limited treatment options and countless people were suffering, even dying every day, much like what we're seeing right now with COVID. And these life-changing experiences, all taken together, put me on a 25-plus-year path to figure out a way that I could eliminate health disparities and connect with and be an advocate with and for patients, particularly those who are underserved and those who can't advocate for themselves. And now, certainly in my role as Pfizer's chief patient officer, I have the opportunity, but most importantly, the immense responsibility of making patients, all patients, our North Star and our partners and focus in everything we do. Because let's face it, in order to eliminate health disparities and ensure that the medicines, treatments, and vaccines we develop have the opportunity to reach all patients, with the hope of benefiting them and achieving our mission to bring forth breakthroughs that change patients' lives, we must have direct input and participation of patients from all walks of life. And like each of you at Pfizer, we see how devastating the COVID-19 pandemic has been. And we're very proud that we, together with our partner BioNTech, have been able to develop a vaccine and make it available to patients in record time. As many of you know, in December, the Pfizer-BioNTech COVID-19 vaccine was authorized for emergency use by the U.S. Food and Drug Administration. And keep in mind, this is not an approval, but an authorization for it to be used in individuals age 16 and older to prevent COVID-19 for the duration of the pandemic emergency. If you're interested, there's more information that can be found at cvdvaccine.com. But, with healthcare systems scrambling, with ICU beds at capacity, with personal protective equipment shortages and staff shortages continuing to prevail in many parts of the country, it's not patients, not just patients that are suffering. Each of you know all too well that frontline clinicians continue to face risky, heart-wrenching, physically exhausting conditions, all elements that can contribute not only to burnout, but also add to the very unacceptable nursing shortage that Dr. Dawson mentioned earlier in the presentation today. So it's clear that relief in any shape or form that it takes is desperately needed. And certainly we at Pfizer are aware of the responsibility that rests on our shoulders with this pandemic. And like Dr. Nunez Smith mentioned, this virus is not impacting all people equally. It's a fact that vulnerable and underserved communities, including racial and ethnic minorities, face significantly increased risk of both contracting and suffering serious consequences as a result of COVID-19. And moreover, underserved populations and communities of color also have some of the highest levels of mistrust of a COVID-19 vaccine. And before I move on, I think it's important to contextualize and acknowledge the medical mistrust, since in many ways this mistrust is legitimate and it's been well earned. The reality is that our nation's healthcare system and researchers of the past have not always treated racial and ethnic minorities and other underserved communities with the respect and the dignity that we deserve. There are many historic transgressions where people of color were not treated respectfully. In some cases, they were even harmed. Think about Tuskegee, the unauthorized use of Henrietta Lacks cancer cells, the Guatemala syphilis experience, the Havasupai tribe experience. The list goes on and on, unfortunately. But we don't even have to speak in historical terms. Like the Honorable Lauren Underwood mentioned, many communities of color continue to face barriers to accessing health services today, irrespective of socioeconomic status. And that includes institutional and systemic racism, implicit bias, and microaggressions. But I don't know why we always say microaggressions. Many of them are macroaggressions. But that's why I'm so excited that at Pfizer, equity is one of our core values. And we've made it a priority to champion equity throughout our vaccine development process. I was asked to walk you through a few of our efforts to reach underserved communities and to help reduce health disparities. So let me just talk about our diversity in our clinical trial. First, we were clear from the outset that we wanted to make sure that any COVID-19 vaccine candidate we developed could be tested for safety and effectiveness in communities that have been disproportionately impacted by the disease as one way to advance health equity. And so to that end, we took intentional steps to make sure that our clinical trials were diverse and inclusive of the individuals and communities that are among those at highest risk for COVID-19. We know that if historically underserved populations are left out of clinical trials, they risk also being left out of the medical breakthroughs down the line. And as just one example, we selected our clinical trial sites in diverse communities to eliminate transportation or access to a research site as one of the many known barriers to diverse clinical trial participation. But we also shared our commitment to clinical trial diversity with our trial site principal investigators and staff and held them accountable to partner and engage with their respective communities and community organizations to increase awareness about the value and importance of clinical trial diversity. And I'm proud to say that our work paid off because approximately 42% of our global participants and 30% of our U.S. participants enrolled in our clinical trial came from diverse backgrounds. And it's important to highlight that these enrollment numbers are significantly higher than the average minority participation rate in clinical trials in the United States. And we're very proud to to have achieved this level of diversity in such a short period of time, but we know that our work is far from over. But we are committed to doing more, and most importantly, to leveraging the learnings from our COVID-19 trial and applying these learnings to further advance equity in our clinical research studies going forward. But what's important, as with most successes, this work wasn't done alone. We at Pfizer see authentic and genuine partner engagement and trust building as the common denominator across all of our efforts. And we are truly grateful for our longstanding and impactful partnership with NBA leadership and members. And fortunately, through our Multicultural Health Equity Collective, co-led by Naisha Foster, our VP of Product Access and Global Health and Social Impact, along with Melissa Bishop Murphy, the Senior Director of National Government Relations and Multicultural Affairs, we've been able to partner with many multicultural community organizations and trusted messengers, including NBNA, but also the National Urban League, 100 Black Men, Dia de la Mujer Latina, and professional associations such as the National Medical Association, the National Hispanic Medical Association, and many others. And among other things, these important partnerships have helped us develop culturally sensitive, user-friendly, and actionable materials and information that's been translated into several different languages. And it's designed to meet potential research participants wherever they were on their clinical trial diversity journey. And we also took the time to connect with and hear directly from key organizations while our teams were developing the vaccine candidate so that we could better understand their needs and, quite frankly, so that we could benefit from their authentic, trusted relationships within the communities that they serve. And, as we move forward, we have a multi-channel approach that we're deploying to ensure broad community engagement about our vaccine. In addition to our already existing multicultural health equity work, we've supported the creation of a U.S. advocacy coalition to build understanding and confidence in COVID-19 vaccines. And it's called the COVID-19 Vaccine Education and Equity Project. Now, this work is convened by the Alliance for Aging Research, Healthy Women, and the National Caucus and Center on Black Aging. And to date, NBNA, thankfully, and many more organizations, up to over 100, including the American Nurses Foundation, Caregiver Action, National Association of County and City Health Officials, and many others are partners. And the goal is really to convene a dialogue like the one we're having today amongst organizations that represent constituencies that face a challenge from COVID-19, particularly diverse communities and those communities on the front lines of the pandemic. The goal, again, is to aim to educate on vaccine safety principles, encourage adherence to treatments, and in addition to the standalone website, which you can find at covidvaccineproject.org, we're also supporting the development of one-pagers, infographics, and social media toolkits, and many other things to improve vaccine understanding and confidence. And these efforts, combined with our ongoing work to reach multicultural communities through the Multicultural Health Equity Collective, really our goal is to raise awareness and educate about vaccinations, and most importantly, to reduce health disparities. So let me close by highlighting our amazing partnership with your esteemed organization, the National Black Nurses Association. Our team knew very early on the vitally important role nurses would play in the health and healthcare of those impacted by the pandemic. And while NBNA has had a longstanding relationship with Pfizer, I have to say that it's been a tremendous pleasure and an honor to work with NBNA leadership during the pandemic, and most importantly, to see the amazing work the organization has already done and will continue to do to make sure that nurses, key members of our healthcare ecosystem, receive the services and supports they need to continue their life-changing work during these unprecedented times. I mean, wow! I heard the music and the video just before I came on. It's amazing. I'm so excited. I listened to the words and they were so powerful. Just last year, at the height of the pandemic, the Pfizer Foundation, which is a separate legal entity from Pfizer, Inc., with distinct legal restrictions, provided a $1 million grant to the NBNA to focus on two areas of need. First, the Reset Initiative that you just heard about in the video. It's an initiative around mental health, which aims to provide mental health and wellness services for NBNA members and their families. ensuring that nurses can access confidential, culturally sensitive, and free counseling services, as well as educational webinars, wellness podcasts, and more. And that's key to assisting each of you in maintaining your mental wellness throughout the COVID-19 crisis. While you're taking care of others, we want to take care of you. The support line is available 24/7, 365 days a year, and it connects people with licensed clinicians for no cost, confidential guidance and resources. And there's also something called Text Coach, also known as text therapy. It's available for NBNA members. Licensed clinicians will help nurses and their families boost emotional fitness and well-being. So I really encourage you to check out NBNAreset.com if you haven't already. And secondly, we are so proud to support NBNA's Rethink initiative, which aims to build awareness around the importance of vaccinations. Now, the goal of Rethink is to debunk common myths surrounding vaccines and to inform Black nurses and the Black community on the benefits and risks of vaccinations. Because let's be clear, vaccination hesitancy in underserved communities didn't just start with the COVID vaccine. And among other information you can find on the website, which is at NBNA, rethink.com, you'll find an interactive test to test your flu IQ. So please go to that site. And again, it's NBNArethink.com. So as I close, I just want to again say a huge thank you to NBNA leadership and to everyone who joined us today for your incredible contributions to the health and welfare of our nation, always. And I also want to emphasize that for me, as heartbreaking and challenging as this pandemic has been, I also see it as yet another inflection point, a time to truly reset, an opportunity to stop and establish a new normal on how we and others in our communities engage much more effectively with and demand that our nation's healthcare system better meet our needs and the needs of our friends and families. As Dr. Nunez says, even though health equity has never been a true priority in our nation, let's hope that a positive that comes out of COVID is that health equity will take its rightful place at the forefront of our nation's decision making. You know, in the inimitable words of Dr. Martin Luther King Jr., and I quote, "Of all the forms of inequality, injustice in healthcare is the most shocking and inhumane," end quote. So no doubt this pandemic has made one thing abundantly clear. We are all in this together. The responsibility for our nation's health and health equity is both individual and collective. And with COVID-19 cases and deaths continuing to rise, we know that every second of every day matters. The numbers are truly astounding. On average, with more than 3,000 Americans dying each day as a result of COVID, that's roughly 2 people dying every minute. Let that sink in. And you know, at Pfizer, I just want to say that my colleagues and scientists and other leaders all around the world, we are working around the clock to try to get this right. But we know that serious business lies ahead, and it's going to be critically important for all of us to stay on top of the facts and accurate information that we know about the vaccine, to reach out to our friends, our families, our constituents. We've got to meet them where they are. We've got to debunk the myths that are out there. We've got to respectfully acknowledge fears. We've got to answer questions. We've got to address challenges and barriers, and we've got to address them head on, because the alternative is unacceptable. Standing on the sidelines is not an option on this one. We as leaders of good conscience cannot sit idly by and risk having the negative impacts of the pandemic on racial and ethnic minorities and other communities, those at most risk of hospitalization and death, become even greater, leading to further exacerbation of already existing and unacceptable health communities. So I just want to say, as an eternal optimist and a woman of faith, my glass is always full. So I remain optimistic that if we put forth our best efforts and bend the arc toward health equity, we can and will come out of this pandemic stronger and more resilient than ever. So thank you again for inviting me to join you today. And most importantly, thank you for your leadership, for your tireless efforts, and everything you do to make the world a healthier and equitable place. We're deeply honored by our partnership. Thank you very much.
Thank you, Dr. Richardson-Heron, for that excellent presentation. We are also at NBNA so grateful for the longstanding partnership with Pfizer. You are truly always welcome here. All right.
Thank you.
Moving on.